Patrick Hutzel from intensivcarehotline.com with another quick tip for families in intensive care. So today's tip is about another frustration that one of our readers, John, has shared. And he says, "Hi, Patrick. I have been asked to move my father to a long-term care facility with an ICU because we are only day 6 of intubation and he's making progress in weaning off. They want to do a trach and a PEG and want to send him to LTAC. After watching all of your videos, it sounds to me like that might be unnecessary. Can you please shed more light on this?" Absolutely, John. Thank you so much for sharing your dad's situation. And obviously, John is in the US because LTAC is very specific to the US. Long-term acute care is what LTAC stands for. Now, here's the deal. Many patients in intensive care that end up on a ventilator with a breathing tube and can't be weaned off after day 10 to day 14 might need a trach, might need a tracheostomy. Now, they definitely don't need a PEG tube, but I'll come to that in a minute. So what should John do here? Well, the number one goal for any patient in intensive care is to wean off the ventilator with a breathing tube. That should be the number one goal. And if he's making progress, why would they even start talking about sending him to an LTAC? That sounds to me like they're not acting in the best interest of John's father. It sounds like they're acting in the best interest of the hospital, which is make as much money as possible and then send the patient out as quickly as possible so they can get the next profitable patient in where they can make a lot of money, rather than focusing on weaning John's dad off the ventilator and doing the right thing and avoiding a tracheostomy. Now, they're already trying to set him up for an LTAC. Now, LTAC, once again, stands for a long-term acute care facility, and once a patient in intensive care in the US is a tracheostomy and a PEG tube, they often get sent to LTAC facilities. LTACs are not even the better version of a nursing home. They are places that need to be avoided at all costs. The best place to wean a patient off the ventilator is intensive care, because you have intensive care doctors, intensive care nurses, you have respiratory therapists, you have a whole multidisciplinary team that is well equipped to wean patients off ventilation. Now, in this day and age, it looks like most ICUs in the US are now going down the track of, doing a trach and a PEG tube and sending patients to LTAC, not for clinical reasons. It's mainly to manage their beds, their bed flow in ICU, empty beds, maximize profit, maximize revenue, and then send patients out. That's the unfortunate reality of the situation. Now, here's how you can counteract this. Don't give consent to a PEG tube under no circumstances. A trach might be the right thing to do, and a trach has its time and its place, But if your dad is making progress, it sounds to me like he's halfway there, and they should be able to take the breathing tube out in the next few days. Now, you haven't shared why your dad is in ICU. That would certainly be helpful to share that information with us. But in either case, if he's making progress, well, you should be able to wean off the ventilator and the breathing tube. Now, I also have written an article, How to Wean a Critically Ill Patient Off the Ventilator and the Breathing Tube, and you can check that out. I have put the link below this video. Now, here's another thing. You're saying that the LTAC, the long-term acute care facility, has an ICU attached. Well, if your dad is well enough to go to LTAC, supposedly, why would they even need an ICU there? Why can't he stay where he is? Why can't they finish the job? Why would you send someone with a critical illness to another facility? That sounds like it's very, it's not in the best interest of John's father here. Just keep that in mind. And just for reference, just have a look online and Google reviews for LTAC facilities. That's probably telling you everything you need to know. But in order to put a stop to it one way or another, A, get them to push for extubation. If you don't know what signs to look for, you can reach out to us, and we can help you with our consulting and advocacy service, making sure that your dad gets best care and treatment, making sure that you make informed decisions, have peace of mind, control, power, and influence in a situation like that. But don't give consent to a PEG if your dad does need a trach, because LTACs can't look after PEG tubes, and your dad will be perfectly fine with a nasogastric tube. I've made videos about PEG tube versus nasogastric tube, and why to avoid a PEG tube at all costs. So that is my quick tip for today. We have a membership for families of critically ill patients in intensive care at intensivecarehotline.com. You get access to our membership for families of critically ill patients in intensive care at intensivecarehotline.com by you clicking on our membership link, or you go to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in the membership area and via email. And we answer all questions intensive care related. I also offer one-on-one consulting and advocacy for families over the phone, via Zoom, Skype, WhatsApp, whichever medium works best for you. I talk to you and your families directly. I talk to doctors and nurses directly. And I make sure that I ask the questions that you haven't even considered asking, but that must be asked. I've worked in intensive care for over 20 years in 3 different countries, where I also worked as a nurse unit manager for over 5 years in intensive care. And I have been consulting and advocating for families in intensive care for the last 10 years as part of my intensivecarehotline.com consulting and advocacy service. Now, I also represent you in family meetings with intensive care teams, so that you have clinical representation, that you have a strong advocate there, so that they don't take advantage of your inexperience, and that they don't take advantage of you haven't worked in ICU, you don't know the clinical ins and outs of intensive care. You need to have strong representation in family meetings with intensive care teams. Now, we also offer medical record reviews in real time, so that you can get a second opinion in real time. And this is all so that you can make informed decisions, have peace of mind, control, power, and influence. We also offer medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are suspecting medical negligence. For any of it, please contact us at intensivecarehotline.com, call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com. Now, if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, share the video with your friends and families, and comment below what you want to see next, what questions and insights you have. Thanks for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.